Hello, everybody, and thank you for joining today's webinar on EAPs and workplace mental health supports. What's next? I'm Dr. Suan Wong, and I'm here today with our esteemed guest, Dr. Warren Chappelle. Now, for those of you who are joining us, who have joined us before on our webinars, certainly welcome back. For those of you who are new to EHN, we are a leading network of treatment facilities across the country for addiction, trauma, and mental health. We offer inpatient services with amazing treatment centers coast to coast, as well as virtual intensive options that are really making treatment accessible and flexible. To stay updated on our future webinars and newsletters, we invite you to opt into our mailing list by filling out the form that has been linked in the Q&A section at the top of your screen. You can also visit our website at www.ehnccanada.com. For today's webinar, everybody's camera and microphone are turned off, but please feel free to use the Q&A box to submit your questions for us today. We will also be sending out a follow-up email in the next week that will contain a link to today's recording and any relevant resources. In terms of a land acknowledgement, myself and Dr. Chappelle are based in Toronto, which is located on the traditional territory of several nations, including the Mississauga of the Credit, the Anishnabe, the Chippewa, the Haudenosaunee, and the Wendat people. It is covered by Treaty 13 with the Mississauga of the Credit. If you are new to this work and want to find out whose land you were on or grew up on, please visit www.nativeland.ca. Now, allow me to properly introduce today's honored guest, Dr. Warren Chappelle. Dr. Chappelle is a pioneer and father of employee assistance programs, or EAPs, in Canada. He revolutionized workplace mental health by making counseling accessible and at no cost to millions of Canadian employees, and created countless career opportunities for thousands of counselors. Dr. Chappelle has directly counseled several thousand clients himself, and through his EAP firm, Warren Chappelle Consultants, his counselors have helped over 5 million clients in need. At an organizational level, Dr. Chappelle has consulted in a range of areas, including communications, leadership, management, training, harassment and bullying prevention, and more. He has worked with large organizations, including the HRPA, the CIBC, and Stephen Kellogg, to name a few. Today, Dr. Chappelle remains deeply passionate about improving mental health and well-being in workplace environments. And now, without further ado, I would love to get our session started. Hello, Dr. Chappelle. How are you today?
I'm glad to be here. Thank you.
Yes, wonderful to have you with us as well. Now, to kick things off, I would like to ask, what was the original inspiration or motivation for you to develop EAPs in Canada?
Well, this happened around 1979. Up until then, I was working in organizational and managerial psychology, and I was helping organizations assess managers for promotion and for further development. And so indirectly, I developed an enormous amount of credibility among HR people. And from time to time, they would bring someone to my attention for counseling because even though I was consulting in organizational issues, they had issues around some of their employees that needed counseling and they didn't know who to turn to. So when I went to the University of Pennsylvania and got my PhD in clinical psychology and I came back, I already had a little bit of credibility with HR people in the clinical counseling area. And what happened was one of the larger organizations, a school board actually, in the North York Board of Education, decided to provide mental health counseling to all of their employees. And that was really an amazing experience for me because we had to compete with other providers. And it was a turning point for me because at that time, no one was really concerned about providing mental health counseling for their employees. And here was a group, a large group, that actually did that. And so when we got the contract, uh, I was very motivated to take this concept, do it well, and then extend it to the rest of Canada. And that was quite a stretch for me because we had to convince organizations to pay employees' mental health. And up until then, most organizations, if not all, actually, wanted to just send their employees to their medical practitioners to get the mental health that they needed. So they were rather naive, and but I took it upon myself to convince them one by one, and it took a while that they had to actually pay for the wellness of their employees and encourage their employees to participate in wellness programs. And at that point, it was the EAP.
Right. Yeah. So I think a lot of people probably don't realize how big of a change that was to introduce mental health care into workplace settings, and for employers to be able to pay for it. And, how has that changed over time since you first introduced those concepts?
Well, in the earlier years, one of the things that we had to do was put a limit, uh, and that's on the number of sessions because because organizations actually were very reluctant to pay for the mental health wellness of their employees. So we had to, in my estimation, a half a loaf was better than no loaf at all. So
Mhm.
introducing people to mental health counseling was really important, and to give them a place to go to help them through the short term um, problems that they were experiencing, and to get some talk therapy, get some help with what they were going through. So some help was better than no help, but we really unfortunately had to bend to organizational needs to reduce the cost, to keep the cost down low. And so we started with a 4 session model, which really became, unfortunately, it became the model for all short term for EAP counseling. And unfortunately, we all know as professionals in the field that people need more sessions than 4 sessions to help them with their personal difficulties. The 4 sessions does two things. It helps them to get over the hump that they're going through, and it temporarily massages their issues in a way that it gives them some assistance to deal with their short term issues, but not the long term issues.
Mm.
But it was a challenge, and so therefore we compromised in the process. But in reality, we know that people need more sessions, but not only more sessions, but they also need access to expert advice and information and therapy about how they can resolve their difficulties.
For sure, yeah, and I think, well, we're certainly going to dive into a lot more of the different aspects that you mentioned, but I wonder if we could also take a little step back and think back when you first started EAPs and they were really taking off. Was there a particular success story that really inspired you and reminded you that was a great thing that you've done?
There were several there were several incidents that I'll always remember because they happened early in our providing EAPs. But the one that really stood out was a very unfortunate, tragic situation where a young father, and he took his 2 kids to a variety store, and he popped in to buy a few things, and he left the kids in the truck. It was a truck that they were driving, a half-ton truck, and unfortunately, for some reason, the brakes came loose and the truck started to roll down the hill and actually rolled into, broke through the ice.
Oh
And so the
gosh.
2 children were lost, were gone. And it was a challenge for us because we had to deal with a whole range of emotions from both the father and the mother, the
Mhm.
guilt, the loss, the grief, the anger, the disappointment. Uh, and at the end of the day, we were able to keep the marriage together, to help them identify the supports that they could give to each other, and the ability to forgive uh, the disaster, to forgive what had happened. And it was a real success story for us to keep the relationship going and keep it together, and to help them overcome their grief and the loss that they went through.
Sure. Well, thank you very much for sharing that story. And it's it's certainly not easy to encounter situations like that, but very many of our healthcare providers, our mental health professionals are on the front lines of situations like that on a regular basis. And it's great to hear that you and your team were able to support that family in their time of need. Sure. But kind of like I said, some of those situations are certainly not uncommon. And maybe if I bring up just a couple of stats actually related to mental health in our space and in our world today. Certainly on the left-hand side, I think probably the audience is very familiar with that stat. We hear it a lot. And 1 in 5 Canadians experience a mental health illness at any time, and that's from the Mental Health Commission of Canada. But maybe some of the other stats on here are not as familiar to our audience, and that includes well, one new one from Statistics Canada, and that 1 in 3 of those with a mood, anxiety, or substance use disorder have reported in 2022 that they had unmet needs or only partially met needs when it came to mental health care. Another stark stat is that mental health is the #1 cause of disability claims in Canada, and actually 70% of disability costs are related to mental health or mental illness. And then the last stat on here, which I think is particularly worrying, is that after 6 month absence, and this is mostly related to disability, but there's only a 50% chance of a worker returning to their job. And after 1 year of an absence, that chance declines to 20%, and after 2 years, only 10%. So pretty stark stats, especially when we look at mental health in the workplace and what employers are doing and can do to continue to support employees. I guess, Dr. Chappelle, what do you think we're still missing here? Where can we continue to make improvements?
Well, the stats that you present, um, they capture the cost of mental health illness, and but there's two elements here. One is the cost, and then the other is the humanity part, the people caring part, and those two are very important to keep up front and center. So not only do we have cost to an organization, real cost, the disability costs are enormous, and organizations have to be mindful that these costs are very real to them. And but what comes before is the people caring part. And always people will respond in a productive way if they're cared for. If people feel that their managers and their senior managers are people that care for what happens to them and how it happens to them. And that's why EAP was very successful, because it showed an interest. People had an interest and a caring attitude toward their employees. Uh, and so the costs are one thing, but it's also the humanity that is another, and that both are very important in promoting EAPs among employers.
Mhm. Sure, it's having that resource and knowing that somebody is there when you do need them. Um, now, I do know that most organizations today do have an EAP in place, and sometimes there are barriers to accessing, to knowing that they have that service available. What role do you think EAPs can play in continuing to one, increase their awareness, as well as increase the benefits that employees are seeing from them?
I think one of the things that is unfolding and that's really important and necessary in the mental health area is to train managers and to train people that are overseeing other individuals around mental health and be able to talk about it freely to reduce the stigma that's involved in mental health issues and to make people feel that it's okay if they have emotional difficulties to to be able to seek help when it is needed rather than to hide from seeking help. And I would say that's one of the biggest uh, areas that EAPs have made a contribution. But I still think that some organizations see it as a line item on their budget. In other words, they have an EAP only because they need to have one. Other organizations have it, and then there are other organizations that take it one step further and embrace the employee assistance program to make sure that their employees do see value in it, and it's a top-down attitude and value that is communicated throughout the whole organization.
Mhm. For sure, yeah, and you mentioned education, especially for leaders and managers, and very much a top-down approach. Kind of, what are some of the most successful organizations and you've seen, and how have they been able to approach their EAP and leverage it in the best way?
Well, I think that the training and the message coming from the top down has to be consistent, and it has to be embraced all the way throughout the whole organization so that people feel indeed that it's okay to seek help, professional help when it is needed. And it's really important to have employees feel that it's not going to be held against them, that their job promotions opportunities are not limited because they've sought out mental illness help. And the thing that I also would like to emphasize is that it's not just the mental health issues that people seek EAP counseling for, but it's also having to do with emotional issues that crop up from time to time that may not fall into the category of mental health problems, but they are emotional difficulties that people experience. And therefore, the EAP counseling introduces them to the concept of talk therapy, of, of mental health access when they need it. Uh, so therefore, the training is very important and the acceptance of the program is very important throughout the whole organization.
Mhm. Very much so, and it does also seem like there needs to be more awareness of how mental health shows up in the workplace. And one thing that we actually see a lot at EHN is not as much understanding that mental health is a spectrum. It's not that just you have it or you don't, or you experience mental illness or you don't. It's really there are different levels and different situations that affect how somebody is experiencing mental health. And maybe at this point, I'll bring up one more slide to guide our conversation. And it would be this one, just kind of summarizing. The different levels of mental health that we see, and this is, probably more simplified too than what it looks like in reality. But what we certainly see is a range of mild, moderate to severe symptoms that individuals might be facing. And Dr. Chappelle, you mentioned, EAP started off with that 4-session model, really to introduce employers to the idea of covering counseling for employees and really just getting into that space and and making a little bit of a change, a little step at a time. But what we're seeing is that EAPs are really great for that, really great for individuals who are experiencing episodic issues or emotional, personal, family incidents that are affecting their mental health at a given time. But what we've also seen through the pandemic is worsening symptoms, where we're seeing individuals now moving into moderate or even severe levels of challenges that they're dealing with. And sometimes that first stage of counseling or wellness app, it maybe isn't enough. And have you been seeing that as well, Dr. Chappelle, in your work and the consulting that you continue to do?
Yes, very, very much so. Uh, the issue with EAP is it's really focused on the short term and the introduction of employees to the counseling model and to talk therapy. But in reality, there are emotional difficulties that are more severe, and just having more sessions is not the answer. I think some EAPs feel that if they give people more sessions, that somehow these severe emotional difficulties that they're having or expressing in the counseling sessions will be resolved, but it isn't necessarily so. They have to look at referral, so that not all EAPs can address all of the problems that are presented. And those people with more severe issues of anxiety or of depression or of addiction need additional and counseling that really is more intensive and more involved and more mindful, so that people can meet their needs at all levels. So the EAP is only one part of the process, but indeed, once people are introduced to the concept of mental health and seeking help with their issues and problems, those that have more severe issues need to be referred. And there are organizations such as EHN that can do that, that are able to address the more severe problems uh, with more intensive therapy and treatment exposure.
Mm-hmm. Yeah, that's certainly what we're seeing a lot is, individuals may have had that counseling experience and maybe they're not seeing the improvement that they were hoping for, and they're needing more. And sometimes it's due to access. You might live in a remote area where it's not as easy to get to the services that your employer might be offering. I know a lot is virtual currently, which opens up the world to a lot more people, which is wonderful. But you're right, there's certainly still a lot of barriers. Um, and very much so. I think what we're also seeing is that a lot of people don't realize that there are next steps or next levels in care. Us, along with a number of other providers, do offer what we call an intensive outpatient program or a virtual intensive treatment option, where it is that next level in therapy. It's actually, at least for us, it is 2 hours of group therapy Monday through Thursday, plus another hour of individual counseling a week. And that goes on for an 8-week long program, plus aftercare that comes along after that, to continue to support individuals even after the intensive portion. So it's certainly not easy. It's not a walk in the park to go through an intensive program like that, but it's certainly effective. And it really helps individuals who maybe don't need to stay in an inpatient facility and be on that end of the spectrum as well.
Yeah, the
Yeah.
thing that I wanted to add to that is um, therapists need to feel comfortable to make to make referrals. It doesn't mean that they can't do the job, but they have to recognize that their clients need more attention and specific attention to some of the problems that their clients are going through. So a referral for them should be natural, should be something that they welcome. In other words, additional professionals and additional services would be available to them, and they should feel comfortable to do that, to make the referrals when it's necessary.
Mhm. What do you think would enhance that? Would help therapists continue to feel comfortable to move individuals on that spectrum of care?
Well, I think two things. One is that the organizations that offer EAP today, the virtual EAP, most of them are now offering virtual EAP, um, and it's still relatively short term. They can increase the number of sessions, which I would encourage, so that people can have the 8 or 9 sessions that will make a difference in their lives. But in addition, the EAP organizations themselves that provide the EAPs should not put pressure on their professionals, the professional counselors to address all the problems. They should introduce them to groups that they can refer their clients to, and that it would be okay, and they should say it's okay to professionals that yes, you do need additional help. Here are some of the clients that we see do need additional help, and this is where the additional help can be available.
Mhm.
So they need to be educated around the various sources of referrals that they can make, and who are these people that they can refer to.
Mhm. Yes, yeah, a number of things, right? And in particular too, like, did you see an EAP, not only providing support and care and counseling, but also kind of in helping that individual navigate what's out there, navigate all the options that are available to them?
Well, I would say in those earlier years, because we had a very short-term concept of EAP, which was for 3, 4 sessions, it was really important to help the or individuals navigate the opportunities or the alternatives that would be available to them. I would say now the pressure on EAP firms is to help as many people within their system as is possible. And so they may not be as supportive of individuals seeking to make referrals, but it's really important for these organizations to help the professionals in their network to be familiar with the resources that are available to them, and to encourage them to make the referrals when it's necessary.
Mhm. Yeah, so certainly, providing more opportunities for healthcare professionals to connect. I know it's hard in the mental health space, right? Like, Google is often our friend, but it might not always give us the information we're looking for, and it can be hard to, vet the space for trusted and reliable partners. What has been your experience, Dr. Chappelle, in terms of finding out the resources that are trusted out there.
Well, I think that it behooves the organizations that offer EAP services to help their counselors uh, become familiar with and do the research on organizations that are out there to help them, to help their professionals make the referrals. Uh, it's a challenging process, but if they do seminars for their counselors, and they offer information about the resources, that would certainly be very helpful to their counselors, and not simply to put the pressure on the counselors themselves to do the kind of research that may be necessary, but to help them in the process would be very helpful.
Mhm. Oh, it's wonderful that you touched on that because oftentimes we're saying, let's educate our employers, let's educate our employees, but certainly, what about the individuals who are delivering care, and how do we support them in doing that optimally as well?
Correct. Yeah, that's very important to make sure that the professionals themselves get assistance in identifying who the referrals are and who are the reliable resources available to them across the country.
Mhm. Very much so. Now, can kind of when we talk about additional treatment options that could be available to employees, sort of beyond your EAP or beyond your individual counseling, we've definitely seen a more positive trend in employers really starting to step up. And really starting to find new and creative ways to partner with organizations that do offer that next level in care. And it's certainly promising, but ideally we'd like to see everybody jump on board with that. And how do you think we can achieve that? And how can EAPs continue to support that effort as well?
I think that, first of all, um, organizations that are doing advanced therapy, that are dealing with intensive issues that employees will experience from time to time. The professionals need to be educated on who is available and who are the resources and where they can find them. So therefore, I think it behooves an EAP organization to provide their professionals with access, easy access to information about who these groups are and who the organizations are that they can make referrals to. So the education of their professionals is really important. It's very valuable, and if anything, and they get more loyalty from their professionals because because work is being done for them. They're being recognized for what they are offering, and they also are being told indirectly by their organizations that contract with them that it's okay if you have people with advanced disabilities around mental health disabilities around these issues, if people are approaching disability issues, if they're approaching serious mental health issues and they need additional resources and referrals, that it's okay to make these referrals, that you're seen as a professional, you're seen as someone who cares about the employee. So the organizations indirectly are saying, we care about you. We care about you at all levels. So we care about you in terms of providing immediate help to help you get over the hump of what emotional difficulties you're going through. But we also care about you to the extent that if there are serious issues that you're encountering that need advanced therapy, that need advanced help, we're there also for you. So that the issue of the problem resolution from beginning to end is what an organization should offer its employees. So, therefore,
Mhm.
in other words, they're saying to their employees, we stay with you. Once you have an issue or a problem, we have the short-term counseling, but we also have referral opportunities for you. And our counselors will help you navigate through the issues and through the alternatives that are open to you and support you along the way so that the problem is resolved. Once you have an issue, we will stay with you right from the beginning to the end, no matter what is involved.
Right. And certainly there's a lot of information out there about the benefits of employers investing in a really strong mental health program. And you already mentioned a few of them. That employee is extremely loyal because they know that they've got an employer who is supportive with them on that whole journey. Certainly you're increasing productivity, reducing turnover, so many positives in that investment, but also conversely, what are the consequences facing employers who don't do enough, who don't invest in their EAP and other options to support employees?
Well, it becomes really a revolving door for some of these organizations in the sense that if they don't offer the help that their employees need, yes, in the short term, they may think that they're saving money, but in the long term, they're actually spending a lot more money uh,
Mhm.
in terms of all the costs that you just mentioned, like the absenteeism, the disability costs, the distraction costs that people have, and now we have various new problems that are occurring and that people need help with being sandwiched between their child care and then their elder care issues. So all of
Mhm.
a sudden, there are always going to be new problems that occur on the horizon. And so it's really important to communicate so we caring about you and the cost that they experience by investing in their employees to begin with, as opposed to investing and spending money on employees down the road. Even turnover is very costly to individuals. So
Oh,
that
for
if they
sure.
can reduce increase the productivity and reduce the turnover, absenteeism, and disability costs, it's a tremendous saving for organizations. And the sooner they know that, the better it will be for them.
Very much so, right? Like, for a good employee, a skilled employee, and especially in industries where that skill is hard to come by, it's not easy to recruit to find somebody else to fill that space, for sure. So, retaining that individual is probably much more valuable than I think a lot of people believe or see currently. So I guess now maybe as we look into the future, how do you see EAPs evolving, right? Like I think you very much brought about that first revolution of introducing mental health supports in the workplace from the beginning, and that was a really big change for Canada, for the world even. Where do you see that going? Where is our next revolution, and how do we make that change happen now, today?
Mhm. Well, there's a big challenge in front of us, and I think that people have to regroup around the mental health crises and the issues that they're being confronted with, and realize that I think there was some sort of magical thought that occurred way back that somehow if we address people's personal issues and mental health issues, that everything would be fine. Uh, but as I mentioned earlier, new problems emerge, new issues emerge for employees as life changes and the challenges around us change, and so that this issue that problems will all go away is not going to happen.
Mhm.
But there will always be issues that people are dealing with, and there's going to be new issues that people are going to be dealing with. So therefore, we have to recognize that the investment in mental health and in wellness is really significant and really important. And that it isn't something that is just simply a program that we offer to people, but it's a continuum of helping people from beginning to end. So therefore, the awareness that there are various helping programs that are necessary for the wellness of their employees, from EAPs, which are the help people introduce people to mental health uh, therapy, uh, to referral programs that are helping people through their intent, because not everybody's going to seek help to begin with. They sometimes
Mhm.
people let their problems stew until it becomes very serious, and so therefore they need referral systems in place to help people to have easy access to additional help. And I would say in the future, people need to see EAPs rather than line as a line on their budget or as a program to nice to have, as something that is an investment in their employees. They introduce wellness and stay with it and look at various wellness programs that will help individuals as well as their managers from beginning to end.
All right. And we've certainly seen a lot of EAPs be, more innovative in recent years, adding on more services, finding different ways to engage employees. And I think HR managers and leaders are a big part of that as well. Right. One of those first steps is just making sure employees know that you have a service available. And then maybe that next step is trying to break down some of those barriers, identifying people don't come forward and don't seek the help, even if that help is there. So yeah. So how
I
can
think
employers and HR teams play a
Yes,
play a
I think
bigger role?
there are two issues that employees constantly cite as reasons for why they don't use an EAP. One is that there is an additional cost, and the feeling that if they use an EAP, their problems will be temporary. But then you see the ongoing costs of therapy can be quite expensive. So that it's really important that an organization meet these needs and they don't allow a financial issue to
Hmm.
stop the person from seeking help. So there has to be more money available for individuals seeking help so that they're not discouraged from seeking help. So for example, some EAPs have 3 or 4 session models, and then the subsequent sessions and treatment are the costs of those sessions are borne by the employee, but there's so many other demands on a person's pocketbook that the cost the I guess the cost of mental health in terms of priorities becomes sort of set down the later in terms of priorities. And so if organizations could help individuals with the ongoing cost, that would help. But the other is to make sure that the stigma is reduced significantly in the sense that people are not feeling that if they seek help with their mental health issues and their emotional difficulties, that somehow they will be held back in promotion. And so, if those two issues can be addressed, I think organizations will be a mile ahead of others.
Hmm. Yes, yeah, and I know there's a lot of organizations out there that are doing great work with Sigma. Obviously, we have Bell Let's Talk Day, which certainly is a lot about raising awareness and encouraging people to talk. But it also feels like we need to take action now. We've done a lot of talking. We've done a lot of idea and discussing what could be done. And now it seems like we are at a time where we really do need to take that next step. And like you said, put our money where our mouth is. Start really supporting employees, um, both with actions and with funding potentially, to be able to seek the help that they need. 'Cause you're right, that is very much a barrier often. You get so far and then you realize that wait times are long, and other services that are privately paid maybe aren't within the realm of possibility for everybody currently. Thank you. Thank you so much, Dr. Chappelle. I do want to remind the audience that our Q&A is open. If you have any questions for us that you would like us to answer today, please go ahead and use the Q&A box. But yeah, and I do see a couple of comments in there, and one that just came through, of course, as well. Let's see. Yep, our company provides private therapy under extended benefits, which is wonderful. And you also have an EAP program. We've had our EAP contact employees to stay with their private therapists instead of supplements with the EAP provider. Oh, that's interesting. And I would encourage the EAP therapists to find ways to complement what is being done, as we know private therapy can be costly. No, that's great, and certainly everybody has a different experience of how we're supporting employees. And I know healthcare providers are often trying to work within the confines of somebody's benefits, terms and conditions, and what funds they have available to be able to provide them with the support they need for sure. I think another individual has mentioned the importance of peer support, which is wonderful as well. And yes, another really great system, I think particularly in public safety and first responder jobs and roles and responsibilities, where peer support is certainly gaining a lot of momentum and showing a lot of positive results as well. I guess, yeah, Dr. Chappelle, have you ever come across kind of the peer support model as well, kind of during your work in your time in consulting?
No, in those earlier years, we really didn't focus on the peer support as much as making sure that organizations were actually providing some sort of access to short-term counseling. In those earlier years, it was very difficult to even get an organization to support an EAP. And as the popularity of EAPs began taking shape, we were able to move organizations to look at other avenues. But the peer support is really important. There's a saying: if your child doesn't like broccoli, make sure that you have 3 or 4 of their peers come over for lunch or dinner that eat
Mhm.
broccoli, and
Yep.
very soon they'll be eating broccoli. So peer support is a very valuable tool to use in helping people make change in their environment. So the peer support is very helpful, very useful.
Mm, sure. I do have another
Yeah,
question here.
yeah,
Mhm.
let me just say the other thing I wanted
Yes.
to highlight is, well, without focusing on a particular institution, but uh, very often we go to tellers, and we do money transactions with tellers. But if you ask any one of them about whether or not they have an EAP, they have no idea what an EAP is.
Mhm.
So what I've always it's been something that I've taken very much under my wing, but I feel communication is very important, about communication about your program, about your EAP. So examples, people will relate to an example, saying you might give an example of a relationship issue, you might give a example of a work related issue. But when you give examples, people can relate to it, can identify to it, and say, well, that's what I'm going through, that's what's happening to me. And so all of a sudden, oh, well, that's where I can use an EAP. So if you do a regular publication to your employees of examples of where an EAP can be used, indirectly you will start to increase the usage, because people can relate to examples and to situations rather than to a laundry list of problems that you can bring to an EAP.
Yes, relatability. Exactly. Like your broccoli example. For
Right.
sure. Okay, I've got a question here. So someone's asking, while dialectical behavior therapy or DBT is being used for borderline personality disorder, it seems it's becoming more widely used for a range of acute mental health issues. Are there any prospects for employers investing in DBT training for their employees?
Well, I'm it's hard for me to respond to that accurately. I have no idea, but I suspect the range of services that are offered to employees should increase. People should have options to the services that they will access when they have personal difficulties. So people have different modalities of learning, different
Mhm.
modalities of being responsive to, and so therefore it is important to offer people a choice of options when they choose to get help with their personal difficulties.
For sure. And I will add to that too. So DBT and CBT, or cognitive behavior therapy, are approaches that we use in our programs as well. And I will say that having sat in on some of our sessions, it's really eye-opening. And we've been lucky enough to invite some individuals from our communities to our professional training days where they do getting some exposure to some of these skills that people are learning through our treatment programs. And I think that's a really great way for individuals to learn what it's like in therapy. And some of these skills are things that we don't naturally learn growing up, depending on your household and depending on who what your upbringing was like. And a lot of the times these skills are really valuable even for the average person. So I think there's certainly value in investing in just more resources, more education, even in learning certain DBT and CBT skills that individuals would learn in therapy as well.
Correct, and
Mhm.
different, and it has to do with the generational differences. Perhaps the older generational people wanted more human contact, the face-to-face meetings, um,
Mhm.
and now we have virtual sessions and virtual counseling. And also, we have now various apps that can help us through the process. But it depends. It depends on your learning modality and which way is best for you. And some people are very adept at working with apps that can help them through some of these issues. And then there are others that still rely on the people contact.
Mhm. For sure. Okay, another question here is obviously there's a lot of mental health tools and platforms, and a lot of them that EAPs offer today. So where do you think all these tools and platforms are going to evolve in the next 5 years? And as individuals, curious as to where you think we're headed down the line.
Well, there certainly will be more of them. Everyone everyone is trying to come up with the magical solution. Um, but it's not going to be easy. There will be many more platforms, many more options available to people to deal with the mental health issues. The challenge I have is how do you keep people motivated to use non-human contact, and that's very challenging because I think that the therapist themselves, the therapist herself, himself, are strong motivators for change.
Mhm.
And once you move away from a face-to-face meeting with somebody, the motivation drops off rapidly. So that apps may be very popular at the beginning, but then they lose their interest. They lose people's interest. They lose people's ability to stay with the app so that that behavioral change can take place. So that's a constant challenge. And I know that different apps have developed different ways to keep people motivated and interested. But what's interesting is that I find that the research that I've looked at talks about a 30 to 40% usage rate at the end of the day on these various and sundry apps. So that yes, there will be more and people will look for the magical solution, but we can't forget it's the individualist, the therapist that provides the greatest motivation for change. Um,
Right. There's a lot to do with that connection, the trusted bond between a therapist and an individual, and certainly, we have both in person, inpatient, and virtual programming, and very much so, our virtual therapists have to learn different techniques of forming that bond over a screen and reading visual cues differently than you would in person as well. So there's certainly a lot of different nuances when you're trying to build out a program that is effective, whether that's virtual or in person or through an app. Very much so. Complex space for sure.
but
Okay.
it's great for it's great for employees, really. It's great for people seeking professional help with their issues and with their personal difficulties, because now there's a range of options open to them, so that
Mhm.
the shopping cart can be pretty full.
Exactly.
And that's
Yeah.
much better than when we first started. Much better.
Right, yes. Now there's a lot of options and also, do we get to a point where there's going to be too many options and how do you, we get back to that question of then how do you start vetting the ones who are really the quality apps or the quality programs and the ones that are trusted and really doing it thoughtfully and mindfully. Mhm. All right, we have another question here. Now, when looking at EAPs, one of the issues that I see are individuals like myself who are in addictions counseling but aren't a social worker or a psychotherapist. We're trained in addiction counseling. We don't get access to EAPs or insurance companies. Many people have requested our services but can't always get coverage to pay as in for addiction counseling. So, when can we expect that counselors like myself will be recognized, through EAP services? Well, that's a loaded question,
That's
maybe.
that's that's a very well, it's interesting because basically my approach is to help people seek professional help no matter what their lot in life is, right?
Mhm.
And the and I think the question is very legitimate. It's a very valid question to ask, because indeed these people are offering a tremendous service, and there are not enough professionals like psychologists and social workers to meet everyone's needs. So we have to look at different levels of people responding to these individuals. And the addiction counselor is as important as anyone else in the scheme of things. And yet their services are not being recognized in terms of reimbursement by insurance companies. So someone has to advocate for them.
Oh, for sure. And, speaking of various stigma, as much as we are speaking about mental health much more openly these days, I think there is often still a high amount of stigma surrounding addiction and substance use issues that people are afraid to talk about still. So yeah, there's a lot more that we can do to continue to support employees in different ways, with different strategies and different professionals. For sure. All right. I think that's coming up to time for us. Dr. Chappelle, is there anything you would like to leave the audience with as the sort of last thoughts or last learnings to take away from today?
No, other than I'm very proud to have been in this field for so many years and to have provided a service that started off as a small item and has become a big item, and it just feels very good. And I'm very delighted to see the tremendous amount of people that are in the field now providing that kind of wellness support and help that is needed. And obviously, the need was there, and we're responding to it. And I want to thank everybody for that opportunity.
Yes. Thank you so much, Dr. Chappelle, and thank you so much, everybody, for joining. I'm just bringing up our contact details onto the screen. If you have any more questions, feel free to reach out to us, and we'll do our best to answer. But otherwise, we will be sending out a recording of today's webinar in a follow-up email, and feel free to share with other individuals who might find this useful. And once again, have a wonderful day, everyone, and thank you so much for joining. Take care.
Thank you.